Hi guys, let's see about fracture of femur shaft. It mostly occurs following high velocity injury. Here the proximal fragment of femur is flexed, abducted and externally rotated, and the distal fragment is adducted. Based on location, we can have a subtrochanteric fracture or mid-shaft fracture or a supracondylar fracture. And we also have a Winquist-Hansen classification. The stage 1 is only a tiny cortical fragment is formed, and stage 2 the butterfly fragment is bigger than stage 1, but still there is 50% more than 50% cortical contact between the main fragments. And in stage 3 we have butterfly fragment involving more than 50% of the bone width. Stage 4 is multiple comminuted segments of fragments are present. Symptoms as in any fracture will have swelling, tenderness, deformity and abnormal mobility. Shortening of the limb length can be seen. Symptom of shock can be there. First we should maintain the hemodynamic stability. Then we should give skeletal traction till the surgery. And the definitive treatment is closed reduction with intramedullary interlocking nail. For skeletal traction we can use a Thomas splint, which is a fixed traction device. It basically has a ring and two bars. The ring which goes and fits on the groin, and the measurement of the ring must be the thigh circumference at the highest point of groin plus 2 inches for any tissue swelling. And the inner bar, the measurement of the inner bar must be the length from the groin to the heel of the patient plus 6 inches. And the inner bar is at an angle of 120 degree to the ring, and then the outer bar, it has a curvature to accommodate the greater trochanter. For management of femur shaft fracture in children less than 6 months, we can use a Pavlik harness, which is a dynamic splint. And for 6 months to 5 years, we can use hip spica cast. And 5 to 10 years, can use flexible nails like TENS, which is a titanium elastic nail system. For more than 10 years, we should use intramedullary interlocking nail. Complications of fracture femur shaft include non-union, delayed union, knee stiffness, hypovolemic shock and fat embolism syndrome, which usually occurs after 24 to 48 hours of the trauma. The patient presents with petechial rash, tachypnea and confusion.